Hello, everyone. Today we are going to discuss something which, in fact, completely changed the way you think about medications like Ozempic, Wegovy, Mounjaro, and other GLP-1 drugs. See, most of the people believe that these are simply weight loss medication, but that's actually not the full story. That's the half story, not even half the story. These drugs were originally developed to treat the type 2 diabetes, and doctors expected them to lower the blood sugar, and they effectively did that. But then something unexpected happened. The patients started losing significant amounts of weight. Those who are using this, they started losing and they are showing some improvement in their obesity level also. And soon after, doctors noticed something even more surprising. The blood pressure is improving, the heart disease risk is reducing, the kidney function is improving, the fatty liver is reducing, and people with sleep apnea started sleeping better, and many women who had irregular menstrual cycle, they started getting regular periods again. Now, see, think about this. How can one medication improve your heart, your kidney, your hormones, your sleep, your metabolism, and your body weight at the same time? So the answer basically lies in the understanding of what GLP-1 actually is. That's exactly what I'm going to discuss in this video. See, for many years, people believed that GLP-1 was simply a blood sugar, hormone. But today, we know that it's not true, right? GLP-1 is actually one of body's master metabolic signal. It is a natural hormone released by your intestine every time when you eat. And once it is released, it basically send message to multiple organs simultaneously, and it tell the pancreas to release only the amount of insulin that is actually required. It also telling your liver to stop releasing extra glucose into the bloodstream. It also tell the stomach to slow down digestion so food is absorbed more gradually. And it also sends a signal to the brain by saying that we have had enough food, you can stop eating now. And it also reduces inflammation throughout the body, and in fact it improves the health and function of your blood vessel also. See, and now you notice something. Only one of these action is reducing appetite. So many other role is there. Many other function is actually done by GLP-1 medication. But the one thing that we talk about, or one thing that you observe, is reducing appetite, and everything else basically improve. In fact, how the body functions totally, and that is why I always tell this medications, in fact, produce benefits which is far beyond the weight loss. Weight loss is just one of the effect. Weight loss is simply the most visible result, and that's what it is known for. Otherwise, if you look at your overall metabolism, your improvement in liver functioning, your heart functioning, your kidney functioning, overall metabolism, overall body composition, in fact, the deeper improvements are happening inside your body. Now, the next question becomes, if our body naturally produces GLP-1, why do we need these medications? See, the answer is, in many people, this natural signal has become weak. That may be because of modern lifestyle, in fact, gradually turns down the body's own GLP-1 response. So there are three major reasons for it. The first is basically this ultra processed food. So when we eat whole natural food, the intestine releases a strong GLP-1 signal. But when you have this highly processed food, that produce a much weaker response in your body. And over many years, the body's natural signaling system that becomes less effective. So that is the first and most important reason, as per my understanding and my reading. And the second reason is the chronic inflammation. It could be poor sleep, or it could be chronic stress or visceral fat, and all keep inflammation constantly active. So this one, this is what I would consider as the another reason. And this ongoing inflammation that basically reduce the body's sensitivity to the GLP-1. So that is why many people who come to me for weight loss, I used to tell them it could be because of inflammation. You don't necessarily want to start with GLP-1. You can start maybe a simple KPV, reduce the inflammation. If your body naturally produce again GLP-1, it's better. So see, most of the people, this extra weight, overweight, could be because of simply because of inflammation. So if you can target that inflammation, then naturally it will come down. There is no need of introducing GLP-1. So straight away GLP-1 I will never recommend. It could be inflammation. So we first start with KPV. That's how the inflammation will come down. I'm just talking about this. In fact, this also have the power to reduce inflammation. But it is not necessary that you need to go with GLP-1. You can even start with KPV, reduce the inflammation. If it is naturally working, that's much better, right? So that's the second reason. And the third is probably the biggest reason, and I would say that is insulin resistance. See, normally insulin helps move glucose into your cell, but when insulin levels remain high for years, the cells gradually stop responding. And this is what basically you call as insulin resistance. And as insulin resistance develop, the normal GLP-1 signaling becomes very less effective as well. Now, the role of these medications is very clear, right? They are not introducing a completely new chemical into your body. Instead, what they are doing is they are just amplifying a natural signal that has become too weak. It could be because of aging, it could be because of your lifestyle. So just think of it like increasing the volume of a microphone that has become too quiet, right? You're just increasing the volume. Just like that, you are giving something extra boost to the body. But the most important concept is these medications are just the bridge, they are not the destination, right? The medication give your body an opportunity to recover, but if nothing changes underneath, if you are continue eating the same unhealthy food, highly processed food, and if you don't exercise, if you don't do resistance training, if you don't do cardio, if you don't sleep well, if your sleep remain poor, or if inflammation still remain high, then once this medication is stopped, the same problems start coming back also. So the bridge only work if you actually walk across it. So what should we build, while using these medication? If you need to keep that, you have to continue that lifestyle also. The first foundation is actually the protein. You will have to have enough protein intake. Sometimes when you use GLP-1 medication, your appetite will come down. You don't have the tendency to eat much. So in that case, you'll have to take care of your protein intake, because appetite becomes much lower, every meal become more important. One of the biggest mistake that people actually make is eating much less protein, and what will happen, you'll start losing muscle instead of fat. That should not be the case. So high quality protein, from you can have eggs, you can have fish, chicken, meat, Greek yogurt, beans, and tofu. That becomes extremely important. And the second foundation is strength training. So whenever you lose weight, the body naturally uses some muscles along with fat. So strength training basically telling the body, keep the muscle, burn the fat instead, because I need this muscle. If I'm working out on my arms, it is telling your body you need this biceps, triceps. When you're working out on the chest, the body is understanding that this muscle is to be protected. Similarly, legs and backs, etc. Right? So it is telling the body that this muscle is important, protect that, burn the fat instead of muscle. So see, even 2 or 3 resistance training session, at least if you can do, that can still make a significant difference. It's not that every day you'll have to go and hit the gym hard. No, I'm not saying that. So that's first protein, second strength training. And the third foundation is managing the side effect properly. That means you'll have to stay well hydrated, drink enough water, eat enough fiber from the whole foods if appropriate, and if it is available, eat smaller meals and stop eating once you feel comfortably full, instead of forcing yourself to finish every meal. That should not be done. So that's something again very important. And the fourth foundation, I would say, that measuring the right progress. We don't focus only on the weighing scale. The scale changes because of water or food or any other temporary factors. Maybe today night I may weigh something and tomorrow morning I'll be weighing different. So instead, you need to monitor your waist measurement, right? Your strength, you can see, your energy levels, you can see, your sleep quality, you can see, and other health improvement that you're getting. And finally, I would say the fifth foundation is building the habits that remain, even after the medication is stopped. See, the people who continue eating nutritious food, they continue strength training, they continue sleeping well, and they continue controlling inflammation are much more likely to maintain the result. So you get a road here, you get the route map, and you got a better lifestyle also. If you can continue that, you'll maintain that result which you got during your GLP period. So those who depend only on the medication, in fact, they'll regain the weight once the treatment ends. And when we step back and look at the bigger picture, something is very interesting, and that is becoming very clear here. See, for decades, we treated obesity, diabetes, fatty liver diseases, sleep apnea, heart disease, and hormonal disorder as completely separate diseases. But many of these conditions actually share the same underlying problem. What is that? It could be chronic inflammation. It can be solved with this. It could be insulin resistance. Could be solved with this. It could be poor metabolic health. And if you look at GLP-1 medication, if used properly, it improves many of these underlying pathways simultaneously. And that is why they benefit multiple organs, as I discussed in the beginning, at the same time. Though it looks just like a weight control medication, but that's not the real benefit of it. So, in fact, perhaps the biggest lesson is this: these medications are not simply just weight loss drugs. They actually help to restore one of the body's most important metabolic communication system. Weight loss is simply the most visible effect of this medication. The real change is actually happening throughout the body in terms of the functioning, entire functioning of the body. So if you use it appropriately under proper medical supervision and combined it with healthy nutrition, exercise, good sleep, and sustainable lifestyle habit, these medications can become a powerful bridge, towards your long-term metabolic health and overall well-being. But remember, the bridge is not the destination. The destination is a healthier body that no longer depends entirely on the medication to stay healthy. So once you develop that lifestyle and the habits, it is your responsibility to maintain it and continue it so that you keep getting that benefits. Once the inflammation is over, don't bring it back. Once the metabolic health is better, don't bring it back. Okay, so this is going to be the objective. So see you in the next video.